Hey friends, just wanted to share something with you here. So a common comment that I typically hear in the chair is, oh doc, it's a back tooth, can we just pull it? You know, it's not really anything I see or worry about. So I wanted to give you a heads up. There's 4 teeth in your mouth that are way more valuable than any of the rest of them. As far as function, there are 4 teeth. They're called your first molars. If you look at them in an x-ray, you'll see they have multiple roots and they're big and broad. We get these teeth when we're 6 years old and we have to take care of them if we want to keep them for the rest of our lives. They are also the most common teeth to have problems and the most common teeth to probably be taken out as well. But what happens is these teeth, God made them with multiple roots because they're meant to take the load of this big old muscle here called the masseter. When you clench down, about 80% of the force is centered around these first molars. So when they're gone, or at least just one of them gone, you now have taken out a load-bearing wall or column in this engineered structure, so that pressure goes somewhere. Eventually what happens is it wears out the teeth you have remaining that much faster, and we start to see these dominoes fall. If whatever happens, you're chewing on the other side and then you lose the first molar on that side, well then you're in a lot of trouble because now you have front teeth or single rooted teeth taking the load of something that it was never intended to. So they start to sometimes splay or move. You'll see movement of those teeth. You'll see chipping and cracking on the edge of those teeth that are remaining. You'll see all kinds of problems start to arise and then lose another tooth and another tooth. So my advice is that the next time you are looking at getting a tooth pulled, or maybe you've already lost a tooth, check and see, is it your first molar? Because if it is, it might be one that you want to invest in either keeping or replacing. That's all I got. Hope this was valuable for you. Take care. Bye-bye.